Good afternoon. Welcome to Genesee County, Orleans County Friday Public Health Live Press Briefing. I'm Rochelle Stein, Chair of the Genesee County Legislature, and I appreciate being with you and offering this update on our status during the worldwide pandemic of COVID-19 and the impact on our counties. Today, I have two very important messages to share with you, and both deserve your full attention. We wish you a memorable Memorial Day, time to stop and reflect on the sacrifices of our military who gave their lives for our country's freedoms, their families who have sacrificed more through the loss of their service member, and those who are serving today to protect and provide for our democracy. Let's give them our quiet reflection, solemn gratitude, and respect this weekend as we observe, while socially distancing, Memorial Day. Phase 1 businesses are now reopened. We ask that you please take great care to continue social distancing of 6 feet apart and face covering when you are with others who do not live with you. We remind you to be very aware that phase 2 reopening is completely in your hands and actions. Take time to protect yourself and your family. Rolling into this holiday weekend, be aware that planned family gatherings and outings are still subject to New York pause restrictions. No more than 10 persons in a gathering. Monitoring the health metrics that will allow for phase 2 reopening is predicated on your behavior, and we are all very eager to get to phase 2 reopenings. Through this message today, we are educating you for your full cooperation of adherence to social distancing, face covering, and sanitization for others who are more vulnerable than you are. Do this for them, if not for yourself and your family members. We continue to stay apart today so we can be together later. Be well and stay safe. And I welcome Chair of the Orleans County Legislature, Lynn Johnson, to the briefing. Lynn?
Thank you, Chair Stein. I appreciate your welcome. Take time this Memorial Day weekend to stroll Main Street, Medina, and see the banners of our hometown heroes displayed. Mary Woodruff, Town Councilman for Ridgeway, spearheaded this project for its second year. Our county enjoys so many freedoms thanks to our hometown heroes who fight to protect us in the military. Our streets are safer thanks to our heroes who patrol our neighborhoods. Our children are loved and well educated, giving our world a future thanks to the heroes who teach them in the classroom. Our poor and hungry are cared for thanks to the heroes who give of themselves full time to care for those in need. Our homes are protected thanks to the heroes who fight fire with their sweat and hard work. Our families are healthy thanks to the heroes who would make it their mission in life. Our county and our communities are a better place to live thanks to the heroes who serve. Even when the enemy is an invisible virus or a microscopic germ, the sacrifices made are just as meaningful. The U.S. military has already lost service members to COVID-19. This Memorial Day, as we continue to honor those who fell for us in battle and our hometown heroes, let's also pause to remember those who have sacrificed their lives while serving others during this pandemic. May God bless them, and may God bless you for remembering them today. Thank you. At this time, I'll bring Paul Pettit, Genesee and Orleans Public Health Director, to give you the update. Thank you.
Thank you, Chairman Johnson and Chairman Stein, for your introductions. Very, very timely and appropriate, and covered a lot of the information that I need to cover, so that should make it a lot briefer on the back end anyway. So, but anyways, welcome to our Friday briefing. Again, as it was articulated very well by both our chairs, we are heading into Memorial Day weekend. It's a great opportunity to remember and look back and to think upon all the sacrifices made for us, and an opportunity for typically celebrations and gatherings, and spending time with one another, with family and friends. And obviously this year, just like with Easter and Mother's Day and potentially some holidays to come, it's going to be a little bit different around here for us, as far as potentially our ability to celebrate and to gather in large groups and to do typically what we've done in the past. And again, we know that's very challenging and not anything that any of us, myself included, want to be doing and having to restrict ourselves. But in today's environment and the activity that we've seen throughout New York State, but even here locally, it's very imperative that we adhere to the guidelines and make sure we're social distancing and keeping our gatherings small, and making sure we're protecting others by protecting ourselves. But again, I just wanted to recognize Memorial Day and those who have sacrificed and given the ultimate for us, for our freedoms. And it's something that is very important to us in this country and here locally. And we definitely want to make sure that we are celebrating and taking time to recognize that this weekend. So I'm going to go through what I typically do with our Friday briefings. I'm going to provide some updates on our numbers for today, go through a few of the highlights of the past week and activities. And again, some of them were already articulated as far as our talking points, and we'll want to make sure we're stressing this weekend going into the holidays. So with that, new case wise, as again, 2 p.m., that's our cutoff for our data gathering for reporting. Genesee County has 0 new positive cases. Again, that is 0 new positive cases being reported today for COVID-19, for a total of 178 positive cases in Genesee County. 3 of the previous positive cases have recovered and have been released from mandatory isolation. So positive trending there, 3 folks coming off, and no new positives. 2 of the total active positive cases in Genesee County are hospitalized. So again, a fairly brief report for Genesee County today, which is good news there. Orleans County, not so necessarily the same numbers, unfortunately, that I'm reporting for Genesee. We'll talk about them a little bit here in more detail. So as of today, reporting again at 2 o'clock, Orleans County has 23 new positive cases of COVID-19. Again, that is 23 cases for a total of 194 positive cases. One of the new positive cases resides in Ridgeway. 22 of the new positive cases are residents of Orchard Rehabilitation Nursing Center in Medina. So again, as you can see on those numbers, 1 community case, again, community-wide still are remaining very low, which is a great thing. Again, 0 in Genesee and only 1 in Orleans. And if you look back tracking over the past week, again, fairly low community spread, which is what we want to see, which is what we need to see in order to continue to move forward in phases. The unfortunate piece here, obviously, is the 22 cases being reported today over at Orchard Manor, the Orchard Rehabilitation and Nursing Center in Medina. Of the new positive cases, 1 individual is in their 20s, 3 are in their 50s, 3 in their 60s, 6 in their 70s, 7 in their 80s, and 3 are in their 90s. So again, more typical ages of our nursing home population. 4 of the previous positive community cases have recovered and have been released from mandatory isolation. So again, some good news in there that we are moving folks off of isolation and putting them in the recovered category. 15 of the total active positive cases are hospitalized. And again, we're not separating hospital cases by community and or regulated facility, again, due to HIPAA and protecting privacy. But a total of 15 cases of Orleans confirmed positives under isolation are in the hospital. Again, reporting out for Orleans. Again, I'm truly saddened to again receive word that we have 5 total residents of Orleans County that have died related to COVID-19. One of these individuals is from the villages of Orleans, and the other 4 reside at Orchard Rehabilitation and Nursing Center. I know one of those cases was reported yesterday, so that is included into this number 4. In addition, 3 more unfortunately have passed due to COVID. So again, our deepest condolences go out to the family and friends of those again that we've lost to COVID-19. And we know it's a very difficult time. We want to make sure we're sending our condolences and best wishes to those that are mourning those losses today. So as I go through some of the cumulative data, again, reading across from the chart, Genesee County has a total of 178 cases, 2,569 negative tests, 11 people under mandatory isolation, 42 under mandatory quarantine, 4 total deaths, and 112 now in the recovered category. Orleans County, 194 positive cases, 1,429 negative tests, 17 in mandatory isolation, 70 under mandatory quarantine, 28 deaths, and 59 in the recovered category. So again, we provided this chart on our non-county regulated facilities that is available. I'm not going to read through it all, but again, just as a reminder here, these are breakdowns in those facilities only. If anything is not listed here, these are facilities that do not have positive cases yet. They will be added in, hopefully not, but if and when they do end up receiving cases over time. So again, keep that in mind, and we do not necessarily follow the positive cases once they're reported. These are monitored internally by the facility and whatever the regulatory agency is. So they are not reported in our daily cumulative numbers. Those are community-based only. And again, as we talked last week, again, based on time, more than likely there's many of these folks have entered into the recovered category. They're just not designated that way officially from our numbers. So just hopefully folks can keep that in mind. Regarding nursing homes, so again, we're all well aware, we talked about it last week, the governor does have new executive orders around mandates on nursing home testing. The counties have been participating in a testing project around swabbing all residents and swabbing all staff. That was actually occurring prior to the new mandate of testing staff twice per week. Again, some of the numbers that we're seeing are part of that project as we start to test residents, which is driving some of that. We've seen that with asymptomatic spread within the nursing homes. And then again, now that we're testing, again, not us, but the nursing homes are testing their staff and any associates, employees, et cetera, frequent visitors into the nursing home, vendors, anybody that may be in there on a regular basis, medical side, they're all required to be tested 2 times per week now. So we, again, are expecting that we're going to start to see a continual climb in activity related to our nursing homes across the state and here in Genesee and Orleans County. And, unfortunately, we are seeing that occurring now already here over in another facility that we had not seen previously. So that is very unfortunate, but it is good that we're finding these cases prior to these requirements and us doing more, I think, intentional testing. We didn't necessarily potentially catch all these. So not a bad thing. Hopefully it'll allow us to be proactive and, be able to move things around and keep folks protected within these facilities. So again, we are expecting to continue to see that climb in our nursing home settings and among staff as increased and very intentional testing is being done. As a reminder, these again are facilities that we do not regulate. We do have communication with them. Obviously, when there are positives, we are notified and we are working with those facilities to make sure that we're providing them with whatever we can, working with emergency management to provide PPE, just again to make sure that we can give them any technical assistance and guidance that we can from the local perspective. And then obviously the state is involved with these facilities along with the administration to handle those cases within the facilities. So some other updates, again, we are in the Finger Lakes region and we are in phase 1. We're now a week into it. Last week we celebrated making it to phase 1 and getting some things unlocked, so to speak, and opened up. And as we head and look ahead to phase 2 now, potentially next Friday, May 29th, again, we want to keep motivation, excitement, and just some sense of relief that we are moving forward in this process. And, we are hopeful that we will start next Friday, May 29th, with our phase 2 activities. As was mentioned the last couple of weeks with the control room, Chairman Johnson and Chairman Stein, along with the other elected officials in the Finger Lakes region, along with some business folks and health people are part of this control room, that again are reviewing the data, making sure that we're tracking things very closely and really staying on top of the numbers, so that if we identify any issues, we'll be able to hopefully act quickly to make sure our numbers don't flip over to the red side and we can stay green along the 7 metrics and standards that have been identified to monitor. So we are continuing to recommend all businesses, organizations, facilities, anybody that's open to the public, that has constituents, that has members, et cetera, coming in. You are required to have an opening plan. You're required to have a business plan that talks about how you're going to maintain social distancing, how you're going to keep your employees or your volunteers safe, along with, again, those that are utilizing your facility or your consumers, whatever it may be, whatever context we're talking about. You are required to have that plan. So we know our phase 1 folks have moved forward and done that, and we're really strongly encouraging anybody that's in phase 2, phase 3, phase 4 to really start having those conversations. Again, we can't really predict how quickly we'll get to these phases. It's going to be driven by the data, but we do know that if all things go well, it could be every 2 weeks potentially moving to a new phase. So we really want folks to make sure they're looking and utilizing everything they can, the resources to develop these plans. And again, they really need to be focused on, social distancing, right? Minimizing capacity in the stores, making sure that you're keeping the 6-foot separations, that you have masking policies, hand washing available. All of these type of things are going to be required as part of that plan. So we are, again, strongly encouraging people to be working on that now, so that when your turn comes, you're ready to go. We are really encouraging folks to go to forwardnewyork.gov. Again, this website has been stood up. It was available last week. This is full of a lot of resources. Frankly, this is where we find out some information sometimes. It doesn't necessarily flow as quickly as we would like from our end, and that's been the case since the beginning. But this is where we want folks to go to. We are not making local determinations on businesses, whether they can open, whether they can't open. We're not making determinations locally on what phase you may fall into. We've been really pushing folks to Forward New York. Again, there's a process there where businesses or organizations can put in their information, and it gives them actually a determination on potentially what phase they may fall in. There's an opportunity for them to, ask questions to, potentially find out if they could be in a different phase based on their operation. So we really want folks to go there. It is full of information, and it's very fluid. Literally, it changes on a daily basis. The governor seems to be making determinations on a daily basis of what and when things are opening or moving forward. So that is the best resource. That is the best place that we can send people to. We are more than happy to talk with folks if they call, but more than likely we're going to end up directing you there in the end. So please refer to that. Please use the template. They do have a draft template there that you can download. It's a fillable document, covers all the categories and more that I just mentioned. And it is something we would really like folks to utilize. It is available, and if you're using that as your baseline, and again customizing based on what you need within your organization, hopefully you'll make sure you're meeting all the requirements for your plan. Again, those plans currently do not need to be submitted. They're not being reviewed. They are just required to be on site and available if anybody asks for them. If there's complaints, if there's concerns, this way you can hold up that document and say, look, this is what we're doing. This is what we've submitted, that we've gone through and identified is what we need to have for our organization. And so again, use the template. It is there, it's available, and we want folks to be able to open when they're able to, and be ready for that. So again, Memorial Day, we talked about it quite a bit. Obviously, the chairs talked about it, and the importance of being smart, socially distancing throughout the weekend and moving forward. It is officially kind of the unofficial start of summer, right? Memorial Day weekend with warm weather and barbecues and camping and all these other different activities that we typically partake in throughout the summer. But again, on pausing and getting to phase one does not necessarily mean we can start having large social gatherings. And even outside, we've heard a lot of comments and questions around, well, if we have this at a park, if we do it outside, is that any safer? Technically, it may be safer, but it's still not allowed under the governor's orders. He's still banning all non-essential gatherings of any kind in any location to less than 10. So again, that's the rules and the guidelines that are being enforced and monitored around the state. So we are strongly encouraging people to adhere to them. Again, as it was mentioned, we want folks to protect themselves and protect others while doing this. And we don't want to see spikes in cases. I mean, that's one of our greatest concerns and fears as folks, again, start to gather. If the numbers climb and they push our metrics over to the red, we don't want to be put back on pause. So it's very important that we adhere to the guidelines and make sure we're doing whatever we can to protect others, especially this weekend and moving forward. All right, so again, just a couple of reminders here. New York is still on pause. There are some different moving dates coming up that potentially may change a few things for us. But as of right now, we remain on pause, at least through May 28th. And there is a complaint line. Again, we do get those reports sent back down after they go up to the state, to law enforcement locally that would potentially go out and talk to these folks and remind them of the guidelines, et cetera. So there is an opportunity, again, if there's concerns over a business or a large gathering that may be occurring, there is a process for reporting that if you're so inclined. Also, again, I mentioned the link for New York in the attachment. There's a lot of links that are there. Obviously, you can click on them if you have them electronically. I'm not going to read through all of them, but there's a lot of information that's out there, a lot of resources available to assist as we, again, try to reopen our region. So make sure you take advantage of those. If you have questions, if you need resources, feel free to click on those as you move forward. There's also a new one I just want to highlight, COVID-19 Test Finder, that was launched this week. And again, this is something that's been put out by the state to help folks find testing within their locality. I do want to say that although that's great that they put that up there, we still aren't much better off than we have been all along locally. There's really no new additional sites that we can send folks to be tested. Again, in Genesee County, UMMC and Well-Now Urgent Care are the primary places beyond your independent healthcare provider that will swab you if they are doing swabbing for the community to go to. So again, we'd encourage you to utilize those resources if you're so inclined and if you're symptomatic and need to be swabbed. Orleans County, we still don't have any better news to share around testing this week. Still remains very limited. Again, beyond your individual providers that are swabbing locally, there is not a open community testing site in Orleans County. We are working hard on this, many calls all week long around seeing what we can do, how we potentially can provide additional access to our folks. Unfortunately, we just have not been able to move that needle yet. Hopefully I'll have good news for you soon. But in the meantime, again, you have to travel a bit if you don't have a primary provider that's doing that, potentially down to one of the Genesee County sites. A lot of testing regionally around us, Rochester, Buffalo, Niagara Falls, those areas all have community testing sites. So again, it is available if you are able to travel. We'd encourage you to get tested, again, if you fit those categories and you need to be swabbed. Face covering, face mask, so again, that is required if you cannot maintain social distancing. So we're again encouraging folks to make sure you're carrying your mask with you wherever you're out and about. Again, if you're maintaining social distancing, there's no requirement that you have to have those on. But if you're in situations where you can't meet that 6-foot separation, you are required to have a face covering on. And again, this barrier here is to protect others from you. These are not N95 or type of mask that would protect you per se from the virus, but it's to protect others from you. So you're again, we know COVID-19 is primarily spread through droplets, and with a container over your face, so to speak, it's gathering up those droplets from your mouth, from your nose, etc., and keeping them from being pushed out forward and towards somebody else. So again, make sure you have those with you. I know a lot of facilities have actually mandated requiring those to even go into some of these stores, which again is part of the plans. So be mindful, be respectful, and wear them as much as possible to continue to help lower the transmission rate and the spread. Emergency management has had some information out in both counties around distributing masks. Again, they've received a lot from different resources and to be able to hand out to folks some basic cloth masks. So continue to follow their news releases around where you can pick those up. And again, as that availability is, I know they're very anxious to push those out. We want everybody to have a mask that wants a mask. So make sure you, again, follow along with the news releases, aware of when those mass distributions may be occurring. One last thing here around the health screener system tracker. Again, I've mentioned this the last couple of weeks. This is available. It's called Rock COVID-19 Health Screener. Again, we're encouraging any residents that are so inclined to sign up for that. It's not mandated, it's not required, but it is a tool for local health officials to monitor and track potential COVID symptoms in the community. It's given to us as far as the data by zip code. And if we get enough folks that participate in it, it could allow us to potentially identify hotspots and be able to potentially react quicker and try to potentially set up different testing or different interim control measures to try to suppress those outbreaks as best as possible. So again, that's available if so inclined. As I kind of wrap up my talk anyways, each week I want to make sure that we're still continuing to hone in on the mental health side of things. We do get a lot of reports we've been seeing, and I'm sure you read the articles around the state, around the country of increased suicide attempts, increased suicide completions, just folks really struggling with, different anxiety and frustration and social isolation issues. And these are real. These are things that are, a fallout and, an issue that we're dealing with as a result of COVID-19. And as people have been, kind of shut away and socially isolated, it has created real tangible issues for a lot of folks. And we want to make sure we're continuing to articulate and talk to folks and let them know there is help out there. There is behavioral health, mental health services in both counties. We have 24/7 access through the Care and Crisis Helpline. And we really want folks to reach out if you're feeling any type of anxiety, frustration, concern. Reach out and ask for help. It's again, no judgment there. It's available, and we want to make sure that people have those resources and are getting the help that they need. All right, so with that, I'm going to pause on what I'm talking about here, and I'm happy to open it up to our press folks if they have any questions regarding the information that we're sharing, and I'm happy to take some questions. Just please make sure you introduce yourself, your name, and whatever media outlet you may be with, and we'll do our best to answer the question. Okay, I'm muted. Okay. Any questions today from our media?
Paul, this is Howard. I'll just say hello. No questions here.
Oh, afternoon, Howard. Hey, I like that one. That one's fine.
Easy one.
I like it. All right. Any specific questions from any other media on the line?
Well, I guess just with phase 2, Paul, I think there will be a lot more activity. Certainly businesses open. It seems like with phase 1, the needle didn't really move too much. I think a lot of the businesses were deemed essential and they were already operating. So I don't want to say how nervous are you or how much more vigilance or would be needed from your department in terms of monitoring things. Or I don't know if you're sleeping a little less as we transition to this next phase.
Well, so obviously, as we've looked at the phases, I mean, you can see the intentionality behind, I think, how the governor has put together the opening, right? So you're starting with kind of your lowest risk potential in phase 1, and then you start to ratchet that up right through phase 2, phase 3, phase 4. So obviously, when you start, opening things up and you get into some more higher risk potential activities, there's obviously some level of expectation we're going to see some increase in numbers. And that's kind of what we've been talking about, really doing our best to minimize that within these facilities specifically that may be opening up in phase 2, which really goes back to the plan, making sure they're doing their best to identify the different, again, mitigation strategies that they can have to minimize that contact, right, and then potential spread within their facilities. But yeah, when you get into phase 2, and you start looking at some of these other businesses and operations that will start to open back up, which is a great thing. We want to see them open and, again, getting some things back to normalcy as best we can. It does create a little bit more of a heightened sense of concern around increased numbers. And again, we know that most folks will weather COVID-19 fairly well with very mild symptoms. But again, we're really concerned about, our seniors, our elderly, those that are immune compromised with underlying health issues. And we all have loved ones that fit those categories, even if we may not. And the concern is, again, the spread, taking it home, taking it to grandma and grandpa, wherever it may be, and potentially having some negative impacts more severe for them. And as we've been talking about, looking at these tracking, these numbers and these categories we're tracking, those are the ones that are going to potentially drive up the issues for us with hospitalizations. If they need to have beds, if they need more intensive care in the ICU, those are the statistics that are going to potentially slow us down. So again, even though some of us may feel stronger and healthier and not as potentially a concern, it is the concern of spreading that back to those other more at-risk populations that can drive the numbers. So again, we do fully expect to see increases in numbers as testing increases. You're going to find more of it. Obviously, with the nursing home requirements on 2 times a week testing of all these folks, that's going to potentially drive up numbers, definitely testing numbers. So we're preparing internally in the health department to obviously ramp up to that increased activity. But again, hopefully we can do it in a safe way that we can keep the severe numbers and keep the hospitalization numbers down.
Well, I just wonder how close we are to the edge where we would have to drop back a phase or be frozen. I don't know if they do go up and we go past the metrics, if we're stuck in phase 2 for a month or something.
Yeah, so it's can't really read all this to you per se, but obviously we do get daily updates on these metrics of where we're at. And for an example, and again, I don't have all the nuance from you, but a lot of these are looking at 3-day rolling averages for the region. Again, this is all 9 counties combined. But as of May 21st, for new hospitalizations, again, for the region, we're at 1.41, and the governor's metric is we have to stay below 2, and that's new admissions per day. So again, that's a rolling average, but that gives you an idea. We're obviously 0.6 under that at the moment. So there's a little bit of leeway there. Obviously we're looking at hospitalization rates. We're looking at bed capacity. As you may be aware, the governor's requirement is we have to have 30% availability of regular hospital beds in the region and for ICU beds. Currently, as of May 21st, available beds in general, there's 55% available, and this is regional. This isn't necessarily one county or the other. And then ICU beds available as of May 21st is 40%. So again, have to stay above 30%. So gives you a little bit of the indicator of kind of the numbers we're tracking, and literally it's day by day. That's, how close the region through the control room is tracking these. So if we start to see spikes, we're going to see that pretty much real time, and it will allow us to potentially make some adjustments and try to right size that before we cross over that artificial line.
Okay. Well, thank you, Paul, and I think you might need a haircut pretty soon.
Thanks, Tom. I appreciate that. I think we all do. So phase 2 is hopefully when that opens. So I'm a big advocate and proponent to get to phase 2 on next Fridays, and I'm going to be calling my person, FYI, if you are listening or watching, set my appointment up soon. So yes, haircuts are in order for a lot of people.
Hello, Paul, Tom from WBTA. That's the reason I have my video turned off. You don't need to see what a mess my hair has become. I had a question exactly about that. The timeline of the phases. A couple of weeks ago, you said 28 days, and that was what was being reported in several of the national news or state news agencies as well. Did they decide that the 2 weeks was rolled into the original 2 weeks so that it's just 14 days instead for each phase?
Yeah, so my best guess here, based on what I know, is that it's a moving fluid target. So what I told you guys a couple of weeks ago is the best that we had. I have documentation emails to show that, but the reality is there seems to be some movement, and again, the logic behind it and how it plays out. This is what we know now. We've been told fairly confidently at this point that the next phase is going to be potentially May 29th. What the governor has said is that moving from phase to phase, he's not going to put a date on it anymore, necessarily, minimum of 2 weeks, but he's not going to put a date beyond that. It's going to be driven by the data. So I guess that we can kind of pull out of that, as long as we're meeting these metrics, essentially, we should move from phase to phase every 2 weeks. Again, that's what I'm telling you today. That may not be the case at 5 o'clock, in 20 minutes, but we're doing our best to try to articulate and share what we know, and because I know it's very frustrating and challenging for all of our businesses and folks to plan. That's why we're just telling everybody to get ready now, because your turn may come potentially quicker than you think it may be. We saw that change already with faith-based organizations who, this week were essentially allowed to move forward with opening to 10 or less. Previously, that was not allowed. It was going to be in phase 4, which obviously is going to be potentially the end of June at the earliest. So things are really moving rapidly. There seems to be kind of on-the-fly changes, and we're doing our best to keep up with it and articulate and share that transparently with everybody locally. But at this point, yeah, it does appear that we could be on a 2-week time frame from phase to phase.
Okay, thank you very much.
Yep.
Paul, I feel like I should chime in. I know the president had urged, I think he did more than urge. I think he ordered them to open up churches. And I don't know how that works with the state of New York, if he can usurp the governor and deem them open.
That's getting a little more technical than I think I have to answer for at the moment, Tom. But what I will, I guess, offer is that with the governor's move this week to open churches, essentially, move them over to the essential category and, basically allow them at 10 or less, I guess one would argue they are open. Obviously not to the level that I think a lot of folks want to see. So again, I can't get into the nuances of the politics of that, but the reality is they are allowed to open now, and they just have to keep in line with the 10 or less restriction.
Okay.
Okay, any other questions?
Paul, this is Howard. I'll kind of follow up with that. I don't know if you had a chance to read the pieces I sent you about super spreader sites, and I just wanted to maybe get your thoughts with the church issue, address maybe what you know or what you see and how concerned you are about, say, large gatherings of people versus, just increased interaction that doesn't necessarily involve large groups of people. Do you think there's anything to that? Would you encourage, people to stay out of large groups and stick to that 10 or less?
Well, I mean, obviously, I'm going to encourage it right now. It is what we're being directed that we're at, right, 10 or less. And I think that really gets into the nuances of, doing it safely, even when we go above 10 or less. I mean, sooner or later, that restriction hopefully will be lessened, whether it goes up to 50 or up to 100. We don't know really how that's going to be playing out, but ultimately, even when you're in these large gatherings, it's very important that you're maintaining your 6-foot separation, or we go back to the masking piece, right? Making sure you have your mask on if you can't meet those separation distances. There are obviously some clear stories earlier on out in the West, obviously with that one faith-based organization that had a large transmission within that choir and the group that was meeting. They obviously weren't social distancing or having any type of barriers, and that resulted in a high percentage of them becoming positive. So again, that is a concern here as those numbers start to grow. If it's not done necessarily in a safe way and folks aren't keeping their distances and or wearing their masks, it definitely could lead to some clusters, and that's really what we want to be concerned with is clusters of activity. And that's why really the contact tracing piece that, the health department obviously is spearheading moving forward is very important. But again, I don't necessarily know if there's anything, to the gathering per se, beyond that you're going to be exposed potentially more people that could have COVID, right? The more folks that are gathering together, the higher likelihood and percentage someone in that group, someone in that gathering may be COVID positive. Could not be symptomatic. They could be an asymptomatic spreader. So that would be, the concern in those environments.
One last thing, Tom Harp here again, switching from my WBTA hat to my minister hat. We've been having parking lot church services at our church since before Easter, and we've been doing fairly well. We were wondering if it's okay that we have people sit outside their vehicles as long as they maintain at least a social distance.
So the official answer is no. Unfortunately, the guidance again is requiring folks in those settings to be in their vehicles. Once you're outside your vehicle, again, technicality that falls now into a social gathering. And obviously, if you have more than 10 folks, that puts you in, I guess, odds with the governor's current order. So, I think that's going to be more challenging, obviously, the environment you're talking with, drive-ins, especially when it's hot out, to not be able, if you're not going to run your car with air conditioning, especially going this weekend hot. So I understand the frustrations and the challenges with that. I mean, again, we're articulating what is being given to us from the state level. But again, currently drive-in type approaches are permissible. Obviously, greater numbers than 10 because folks are in their vehicle and isolated. But once you step outside, technically now you're creating a gathering and you can't be over 10.
Okay, thank you.
Yep. Any final questions? All right. Well, again, appreciate everybody's time, and we'll continue to push out these briefings during the weekdays. Just a reminder, over the weekend, again, it's just going to be numbers. There won't be any updates to the tracking system. And again, that's going to include Monday being a holiday. So the next time the numbers will be updated for all the different things that we push out will be Tuesday, just as a reminder on that. So again, as I sign off, I just want to, again, recognize Memorial Day. Thank you to all of our veterans and folks that have served and given the ultimate sacrifice. And take some time to ponder that and to think about that and remember them and their families and loved ones on this holiday. And, be socially safe, socially responsible. And, we'll continue to provide these updates and the information that'll hopefully help everybody stay safe, protect others by protecting yourself, and keep us moving forward in our unpausing process. So have a good weekend. Thanks.